We can wait for a few more participants. I think we will wait for another 5 minutes. Until then, if any one of you have any questions regarding the preparation, regarding the exam, would you like to give any suggestions? Anyone can say. Yeah, so Dr. Tamistri, are you here? I hope I'm taking your name right.
Yeah, I'm there.
Yeah. Okay, so would you like to, I think you mentioned on the group that you would like to volunteer for today's practice.
Yeah, yeah, the one on ROP.
Yeah, that's great. Yeah, we'll just start in another 5 minutes. Till then, if you have any questions regarding any other thing or any other participant would like to ask any question, give any suggestion to us, how can we make our discussions better? I would love to have that.
Yeah, like you talked about the transport scenario also. That is also
Yeah,
something you can do. Uh, Neonatal
yeah.
transport.
Um, Probably, yeah, we discussed that. It came recently in the Jadda exam, this recent date. And the main issue in that was that the baby was born and preterm, and it had to be transferred to certain facility. And the parents were really concerned about that. So that's why I brought that topic up because usually it wasn't very common to go through those guidelines. And you know that neonatal guidelines are a big part of, and it's really hard to go through all of them. So what my plan was that to just keep all the important ones, just go through all the important ones so that anyone who is preparing and maybe got to know that what are the important things that they have to do. Yeah, so was there any confusion in that for you?
Yeah, I thought if someone does that scenario, it would be better. Like, much
Okay, maybe
convenient.
in the next class we can do that. Today, since we planned to discuss the ROP, so we'll go with that, and maybe in the next one we can, or maybe after the doing the ROP session, maybe if someone else wants that, maybe we can do that if you have some time for that. Okay, so we have around 15 participants, and so hello everyone. Those of you who have joined, I am Dr. Iqra Ahmad, and I'm from Pakistan. I did my FCPS in pediatrics, and working as senior registrar at one of the most like the biggest children hospital, which is University of Child Health Sciences and Children Hospital, Lahore. I passed my exam recently, not recently, it's been a year. I passed my exam from Pakistan Center 1 year back. It was the first time the exam happened in Pakistan. Initially, we had one mock exam. I appeared in that as well, so it was quite a practice. And then our exam was supposed to held in May 2023, but due to some political issues, our exam was delayed. And then in September 2023, I gave my exam, and I got 76 out of 82 in my exam. So after that, I've been taking a little off and on classes for a few, and recently I've joined MedPrep online forum, and I hope to teach you and interact with all of you and help you in any of your queries. So definitely we have our proper course that is going on, and some of you might know it, some of you might have joined it. Our main aim of starting this Telegram conversation was because you know that there are so many things that in once in a while when you are preparing and you're not really ready for the course to start, but you just started your prep and some question arises and you have to, and maybe some of you who don't have a proper group to practice, they need a forum to discuss their queries and discuss their problems. So that's why we want a really active group. But I think we only have three or four active participants here. But then again, we have just started this Telegram activity recently, and we are hoping that we can do more interactive sessions. So what our program basically is that it's the group is open 24 hours a day. You can submit your response. You can give your feedback or you can ask any of the questions at any time of the day. But with the time at times I reply at different times as well, different times as well. But for the live discussion, like I get online daily at 3 p.m. UK time, and for an hour or so, and that is the time when I am actively replying to your queries. So if you have any question at that moment, I'll reply that at that very moment. Since this discussion we are doing, and we plan to have one this kind of Zoom session, free Zoom session weekly as well. So I'll be expecting more and more participants to interact as well. Other than that, what I want in the group is that any one of you who is preparing for the exam and they intend to apply for the clinical, you know that it is an exam in which you have to continuously talk for around 3 hours. It's not an easy exam in a sense that it's a lot of speaking, and it's not just the simple speaking. Every station has a different tone, every station has a different way in which you have to speak. So you see that in communication, you have to be polite, you have to have a different kind of tone, you have to be empathetic. However, when you go into the development station or in history station, you have to be polite as well, but you have to speed up in that station because you need to get the proper information from from the role player, and so there's a different type of pace that has to work in every station. So what I want is that any one of you who is preparing for exam, just send a voice note in the group, and I listen to all the messages that come, and I will guide you accordingly in that as well. So that's going to be a good opportunity for all of you. So I think we have 20 participants, and I think we should be starting a scenario now. So Dr. Tanushi, are you ready? Yeah, hello.
Yes, ma'am.
Okay, that's good. Okay, so I'll give you a scenario, and as you know that after giving, oh, so are you preparing for the clinicals? And do you have a plan when are you going to give the exam?
Yeah, I've applied for the Kolkata exams. I don't know whether I'll be accepted or not.
Okay,
But
okay, best
I
of
just
luck for
applied
that.
for it.
Okay. Right, that's really nice. Okay, so I'll be giving you a scenario, and as you know that after that you have some time, and for those of you, I think probably all of you know that in the communication station you get a scenario outside the station, and you get 3 minutes. Usually there are 4 minutes, but in practice we'll just give you 3 minutes so that you have a practice to do things early. And in the those 3 minutes, you are going to think about your scenario, you're going to read the scenario, and you're going to memorize any of the names that have been written there, any information that has been provided, and what structure that you are going to go through. After that, you go into the station, and the total station is for 9 minutes. The communication station is for 9 minutes. So in this station, the examiner is not going to interact with you. He's just going to go and you're going to start the communication with the role player. At 6 minutes, you're going to get a bell, and someone will tell you or knock the door and tell you that 3 minutes left. And after that, after 3 minutes, when the 9 minutes goes on, you'll be told that the station is over and you'll go out. So same will happen here. I'm going to tell you the scenario, and then I'm going to wait for 3 minutes. If you want to start early, we can start early as well. And after that, I'll be keeping the time. And at 6 minutes, I'll be the role player, and you'll be communicating with me. And after that, after 6 minutes, I'll give you a bell, and after 9 minutes, we'll end the scenario, and after that, we'll have a discussion on that. So there's some issue with my screen, and I'm unable to share the written scenario. So maybe if you have a pen or paper, I can speak it and you can write it down. Is that fine with you? Yeah, okay. I think maybe Dr. Tanushri, hello. Yeah. Am I audible? Can anyone please tell? Is there an issue in my
Yes, ma'am. You're audible. You can just tell me the scenario. I can just
Yeah,
note it down.
okay. Yeah. So I'm telling you, okay, so you are a pediatric registrar in the pediatric ward,
Yeah.
and the setting is the side room of the ward,
Okay.
and you have to talk to Dr. Ahmad. He is a resident, he is a student who has been doing rotation in the ward, in the nursery ward, and he has seen some patients who were born preterm, and there was some discussion in the ward regarding the retinopathy of prematurity.
Rotation in the
So,
nursery.
yeah,
And he heard some, there were some preterm babies, and he heard a
and he
discussion.
has heard a discussion about retinopathy of prematurity, and he has certain questions regarding that. So, your task is to talk to Dr. Ahmed and answer about and discuss him with him about retinopathy of prematurity and answers all his concerns.
Okay, ma'am.
Okay, so your time starts now. You have 3 minutes to prepare, and then we'll start.
Yeah, can I share a picture in the group?
Yeah. If you want to draw a picture or something, you can do that. Yes.
I can start.
Yeah.
Can
Okay.
I start?
Just let me start. Yeah, just let me start the timer, and so that we can have a record. Okay.
Okay.
Start.
Good evening. I'm Dr. Tanushree, the
Good
pediatric
evening.
registrar here. So you must be Dr.
Yeah. I know. Yeah. I know you. Yeah, I've seen you around here as well.
Yes, I have also seen you working here. So how are your rounds going with us, Ahmed?
Oh, they're really nice. I'm really liking the rotation here. It's good to see patients, pediatric patients, and I'm really enjoying this rotation. I think I might even think of coming to pediatrics.
Oh, that's good to hear actually. We need people like you, extra energetic. And I've heard good remarks about you also from the
Oh,
other.
really? You really have?
Yes, yes. And I just got to know that you have something to know. You have got some things to know about some topic on retinopathy of prematurity. Is that it?
Oh, yeah. You heard it right, doctor. So, I saw a few patients in the ward, and some the consultants were discussing something about that these babies need to be screened for retinopathy of prematurity, and I quite really didn't understand what did they mean about that, about screening and everything. So I just thought to ask it from someone, and I think you can just describe a little bit for me.
Okay, that's great. I hope I'll be of some use to you, and you can clear your doubts. So, do you want any of your friends also to be with you so that we can carry on this discussion?
Oh, I think most of them are busy. It's only me. Yeah, you can
Oh,
start.
that's all right. That's all right. Come on, let's go to my chamber where we can have a cup of coffee or tea, and then we can discuss this problem. Is that okay with you?
Yeah, yeah, whatever you say. Yeah, that's fine.
When you hear of this term, retinopathy of prematurity, what does it like? Does it ring a bell? What do you think it could be?
I mean, I know that prematurity is the babies who are born early, and probably retinopathy is something related to retina, probably. But I don't know how this happens and why does this happen, and what's the link of prematurity with that. That doesn't make sense to me.
You're absolutely right. This condition occurs in the very premature babies, you see. And these babies, as you know, most of the premature babies require an ICU admission. And sometimes these babies require oxygen too because of their immature lungs.
Yeah,
Are you
yeah,
with?
yeah. I know yes,
So,
I've seen babies on
while on one
oxygen.
hand, yeah, while on one hand, oxygen is required for them, but on the other hand, sometimes too much oxygen or unmonitored administration of oxygen can lead to this condition called retinopathy of prematurity.
So you're going to tell me that it's because of the extra oxygen that we give to the children? It means the babies, the premature babies, then shouldn't be given oxygen. Is that so?
Not exactly what the oxygen does, let me tell you. The retina is an organ which completes, which is very immature in this baby, and the blood
Okay.
vessels of the retina complete their development at term almost when the baby is born. So
Right.
in a case when the baby is born very premature, say less than 32 weeks, this development of the retina is still not complete. So these blood
Okay.
vessels have still not developed properly. But at the same time, when we give oxygen, we actually stimulate new growth, new growth of these
I
abnormal
mean,
blood vessels.
but you are telling me that a baby who's born early, the retina is not developed properly. So it means that the retina does not develop after that?
The retina keeps on developing and finishes its development. The blood vessels, I mean to say, the retinal vessels, finishes its development round about the time when the baby is born at term. I'm talking about a normal term pregnancy. So when they
Okay.
are born premature, this growth of this normal retina is actually quite prematurely stopped because of the prematurity. And
Okay.
as a result, yeah, and what happens is that when we give oxygen, there is stimulation of new growth. But these new blood vessels that grow are very fragile and they have a tendency to bleed. As a result, what can happen, you see, there may be formation of scar in the blood, in the eye. And it can,
I don't understand. I mean, obviously, like I know that the babies who are born premature, their lungs have to develop. So obviously, retina has to develop. So what's wrong in the developing the retina and developing the blood vessels? How does that happen? That's not making sense to me. Can you please explain it a little more?
you see, this condition occurs due to abnormal blood vessels growing out from the retina. These blood vessels which are fragile and the blood vessels which have a tendency to bleed. And that is
Okay.
why ultimately these vessels grow so much into the eye cavity. It almost grows up to the vitreous cavity, and ultimately what it does, it causes detachment of the retina, and
So,
then
so
that
you're
leads to
telling me this
blindness.
happens in every premature child? This is gonna happen to every premature child?
No, not exactly every premature child. There are certain risk factors, you see. The risk
Okay.
factors would be babies born before 32 weeks, then babies born very low birth weight, and then those who
Oh,
have
okay.
sepsis or intraventricular hemorrhage, or those babies who have apnea, these are the ones who are at risk of developing this condition. But it is a norm to screen all babies born before 32 weeks
So
who have had,
how do we
yes,
screen them, and how can we prevent this? I mean, this seems to be a really dangerous condition. You're telling me that the
uh,
blood goes out and everything like that. So how can we prevent this?
we can prevent it by monitoring the oxygen
Three
administration
minutes
to
left.
these newborns. Yeah,
3 minutes
at
left.
in the ICU. Yes, and we also try to prevent further growth and prevent blindness by doing early monitoring of these babies who are NICU graduates who come out of
Okay,
the
so how do we
NICU.
do that? I mean, how often do we do that?
Yeah, what we do is like after their discharge or from 2 weeks, at 2 weeks of age, or we send them to the eye specialist for screening. The eye specialist uses sometimes a special camera which is called a ret cam to look into the
Okay.
inside the eyes and look if there are new vessels forming in the eye.
Right. Yeah.
And
So what if they have formed? I mean, you told me that I'm really scared that if the vessels have formed, what can we do about them? I mean, does the child leads to blindness?
see, I've shown you in this diagram, there are various zones, zone 1, 2, and 3. If it is in zone 1, then immediate treatment would be required. But of course, this will be the decision of the ophthalmologist. And if it's in zone 2 and 3, then a wait and watch policy is usually done. Um
Okay. And what kind of treatment can we offer?
yeah, treatment mostly used is laser, or it's cryotherapy, and sometimes surgery. The treatment is basically to prevent the further growth of this vessel. I think
Okay.
I've given you a lot of information today, Ahmed. Like,
Yeah, yeah, I know. I mean, it's a lot. I mean, I'm just trying to figure it out that what happens in retina and how does this go to this severity. I'm
yes,
still
I can
unable to just
understand.
to make it my mind that how
I
does
can
this all
understand.
happen.
I can understand. Why don't you present this in the journal club this week?
Oh, no, 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 me, I cannot do that. I mean, I just learned
Okay,
about it. How can
then
I present it?
for your own benefit, what you can do is like you can do a quick recap of what we had today, the discussion we had.
Yeah, I can try that. I mean, I don't remember all of the things that you told, but you told me that retinopathy of prematurity is a disease that happens. The baby is born less than 32 weeks, or they are very low birth weight, and it's basically due to the fragile vessels, and you have to do the screening, and the treatment can be laser or surgery.
Oh, that's great. You have almost picked up all the points. So, is there anything else you want to
Yeah.
know, Ahmed?
Yeah, I think maybe I need some more information. Maybe you can give me some links or something so that I can read about it because I think I need to learn about it more. I still
Yes,
need
yes.
to work on it.
I can even suggest you some trusted websites where you can
Yeah,
go
yeah,
through it,
that would be great.
and also some leaflets maybe which will help you understand better this condition.
Yeah, that would be great. Yeah. Okay,
Mm.
your time's up.
Thank you, Ahmed. Thank you, Ahmed.
Yeah, thank you, doctor. Okay, so okay, you have a good style of communication. So would you like to tell me that any of the points that you noticed, and then we can ask anyone else, and then we can discuss on it. What do you think could have been better in this?
Uh, mm, I
Anyone
think
else? Anyone else
I,
from the group? Yeah, yeah. Tell me, you're saying something? Yeah, you were saying something, Dr. Nushri?
yeah, I thought maybe I could have explained the terminology a little better than how I did. I mean,
Okay.
the medical graduate was at times getting a little confused, and he was like, he was telling me again and again, but blood vessels do grow, but how come this is abnormal? So,
Yeah,
like, I could have been a little more clear in making him understand because
right.
that's what I felt, and
Okay, anyone
then
else? I would like any other participant from the group. Don't be hesitant to speak. I mean, I know I've been in such groups and I've always been a silent listener, but I tell you that whenever you speak or whenever you tell something or share your opinion and help someone else, that's going to help you as well. So any one of you, I would like to have at least one other opinion from anyone from the group. Yeah, we have a lot of people here. Anyone can unmute and tell me. Maybe I can take some name, but no. Anyone? Okay, fine. I think no one's coming up. So, okay. So, Tanushi, one thing, the good things first. Your style of starting the conversation was really nice. I mean, it's good to introduce yourself, and I know because there was a little turbulence there, or there's a little disturbance just because we are doing it on Zoom meeting and we're not sitting face to face. Whenever you're sitting face to face, it's more easy to communicate with the person. And this a little hindrance that comes that you want to speak something, and at the same time, I want to speak something. So that doesn't
Yes,
happen
yes,
when you are
yes,
doing
exactly.
it face to face. So one good thing is yeah, I know. I mean, at times you speak and I come to speak, but that's not an issue because we're talking this. When you are sitting face to face, you can know next person's expressions, and the communication. If you have seen the communication and the marking guidelines, you know that it's not just about what you say or how you say. It's also about your body language as well, because they are noticing your body language. How are you sitting? How are you maintaining the distance? What are your facial expressions? Are you actually feeling the empathy or sympathy which you are showing? How much hands you are moving? Because whenever we are in a panic state, we tend to move our hands a lot. So that's something that is seen as well. So that's something that you need to practice on your own. But since your speaking style is good as well, in the communication, one of the issues that we Asians face a little is that we tend to speak fast, a bit fast and a bit loud. So, but you have a good pace of talking and you have a good style of talking. The one thing that um, missed was that initially you did ask me that what do you know about retinopathy of maturity? So I told you once. After that, you never really asked me. I mean, I am a medical student, and obviously, maybe I know a few things or the other. Whenever you're talking to a medical student or any of the juniors, you have to make it like every communication station or every communication should be a two-way. But this one specifically has to be bidirectional in the sense that you have to communicate with the person at least 2 to 3 times and ask them that like what I used to do is that, or what I tell others is that whenever the student asks a question, don't straightforward start answering it. Okay, always ask, yeah, that's a really nice question, so what do you think? I mean, then you say that I asked that how this it should be done, how screening should be done. Maybe you can say that, oh, that's a really nice question. Maybe you can tell me that how the screening could be done. Or when I ask about the treatment, you can first ask me that, okay, what do you think can the treatment be in this scenarios or in this situation? So that could be something that that can make the conversation bi-directional, and it can interact the student as well. The second thing is that the initial introduction and something, it went a bit long. That's why you were unable to finish a lot of other things uh, in your explanation as well. So it's always good that yes, you have to encourage it and you have to have a good. The good thing in the medical student is that you can use the jargons, you can use a bit of a difficult language. You don't have to think much about the words, and the communication has to be a little clear as well. So the sentence that usually said, you have been given a setting that you are sitting in a side room of a ward. So at that point of time, telling the candidate or the role player, the student, that okay, maybe you can come to my compartment, or maybe you can come to my office, and we can have discussion over a cup of a coffee. I personally feel that it waste your 15 to 20 seconds, which could be used in telling the information. So when a setting is given and you have started the conversation and you have asked the role player about any attender as well. So if it's done, so I don't think you specifically need to tell that we can go to some office or something because the setting has already been given. So that's a bit of unnecessary. Other than that, the information giving,
Forgot about
that is
it
a correct.
actually. The setting I did not write in my when you were
Okay,
telling
okay.
the situation.
Yeah, yeah,
Did not
yeah.
write this part.
Yeah,
Yeah.
maybe the scenarios in front of you that make it better. But other than that, information. Whenever you have to tell the information to anyone, you have to be very clear. I mean, maybe you have drawn something in your writing as well. Yeah, maybe you have drawn something on paper and you wanted to explain it with a paper. Because retinopathy of prematurity is something that can come as a scenario to the student as well. It can also come in a breaking bad news to the parents as well. So with the student, you can use that, yeah, retina is this and it this happens. But if you are telling it to a as a breaking bad news to the parents. For that, you need to practice in a way that you need to explain things in a very, very simple matter, in a very, very simple manner. Like what you can, if we discuss it on a whole, and maybe you can draw an eyeball and tell them that you see that this is an eyeball and this retina or is the back layer of. Okay, one thing I want to clear is that we're having a journal discussion on this topic as well. Okay, so regarding your, what I felt is that you need to have a little more interactive because there came a moment in which I wanted to speak, but then I was like, okay, let her speak and let her tell things because if I'm gonna stop for you, you're gonna just get out of that. So next time, if you're having a scenario in which you're talking to a medical student, just ask a lot of questions. Okay, just make it like you're talking to any one of your colleague at any point of time. Okay, don't hesitate that you the person won't know answer. Obviously, they have trained the role player, right? And it's not like you are actually asking a medical student who knows nothing about it. You are talking to a role player, and a role player is definitely going to give you a point, one or two point, and then you are going to take that point further and explain it a bit further. Also, in this thing, since you are talking to a medical student, you probably should have mentioned the stages of retinopathy as well. So, starting from how it actually happens and then the stages, because every retinopathy does not lead to this vascularization with to this hemorrhage and everything. You know the stage, right? Or can you explain if you know
Yeah,
the stages?
I know the stages. I know the stages. But then the medical
Yeah.
student asked me about the treatment. So I went to that. Yeah, I should have told the stages as well. But basically, we were told you have to answer all the questions that the role player asks. It's their agenda and not ours. So that's why and there was no time also.
Yeah, because there was no time. Basically, it was no time, yeah, because that came out to be a little less. But then again, there are some things which have to be um okay, whenever we are doing a educational scenario like that, so definitely there are some important points that have to be covered. Like in any case, so you need to maybe you when you were writing down a summary outside, you maybe say that I'll tell the definition, I'll tell the risk factors, I'll tell the stages, and then I'll tell the screening, and then I will tell the treatment. So maybe these are the important points that could have been discussed. Okay, so maybe after that, if the initial thing was a little explained in a better way, that the retina usually, because you know that you can tell it that you know that every the retinal layer that needs that starts developing and around 16 weeks, or like it's written that it is usually it develops between 16 to 36 weeks of the pregnancy. And if the baby is born early, the development of the retina is incomplete. So there will be areas on the retina which will not have enough blood vessels. So what happens is that after the baby is born and he is giving a lot of oxygen, due to that oxygen, the new blood vessels are formed in the areas which were avascular, and these new blood vessels, they are fragile. They can cause leaking of the blood, which can lead to scarring, and ultimately it can lead to the it can. Sorry, I think I need to mute. Okay, and ultimately it can lead to the it can lead us to affect the vision of the child. Okay, so in a line, you have to have a good line, which you can practice outside it. How are you going to step it? You explain it in a clear. proper and precise way, which can be explainable. Okay? And after in between, you did ask me once that are you with me or are you following me? But we can have it we can ask it 2 to 3 times as well. That are you with me? Am I making myself clear? Is it clear to you? Are you following me? So that can have a good impression as well. Okay, so okay, so basically, what happens in the retinopathy of PGD, if it comes to someone who is a parent and who doesn't even know about what is retina, in that case, you have to tell about retina as well. So maybe you can draw an eyeball and you can tell them that this is the eyeball and this is the um, there's a surface at the back of the eye that converts the images and it sends the signals to the brain due to which a baby can see. And due to since the baby is born early, this layer the inner layer it is not formed properly. So these the layer has areas which are not formed properly and do not have proper blood vessels. So after the baby is born and he needs some oxygen, there are areas which do not have enough blood supply, enough oxygen. They tend to make new blood vessels. And these blood vessels, since are weak and they are not very strong, so they can lead to all of these things, right? So in the such case, when you have to talk to the parent, you will start with the retina, and it's that, and with the student, you can go with that. Other than that, you told me, right, that the low birth weight, the sepsis, all of these things are risk factors. And then you told good about the screening as well, that you have to maybe you can have tell the screening maybe could maybe told in descriptive manner in a sense that you have to do the weekly screening in certain cases, and in certain cases you might have to be 2 weekly depending upon the ophthalmologist, and then the stages. And stages, for everyone who is here, and will just revise the stages. Stage 0, that there is no retinopathy. Stage 1 is where, uh, because as I'm telling you, that there are certain avascular areas in the retina and there are some vascular areas. So there's a demarcation line is being formed, dividing the avascular zone from the vascular zone. So this is the stage 1. You need to remember the stage 1 has demarcation line. What happens in the stage 2 is that the line becomes thicker and it forms a ridge. In stage 3, the vascularization of the ridge starts and the vessels start growing into the cavity of the eye. In stage 4, there is a subtotal detachment of the retina starting from the ridge. And in stage 5, the retina has become completely detached from the back of the eye. And definitely, this is when there's the last stage. Other than that, you might get into know into the guidelines that there are some plus disease, there is a pre-disease. Okay, so Dr. Tanushree, can you tell what are the zones that you were talking about? What are the zone 1, 2, and 3? Okay, hello. Okay, so zones are basically you have a central point in the retina, and around that we have three circumferential zones. Zone 1 uh, is the median one is the zone 1, and as you go to the periphery of the retina, there is zone 2 and 3. The more the central zone is affected, more the severe is the disease. So the one disease is severe. It's an emergency. It has to be treated earliest. And 2 and 3, maybe you can, and maybe 2 and 3 has to be, 2 has to be assessed and 3 has to be observed. Other than that, the treatment options are definitely there can be the first and foremost thing is the prevention, in which depends upon the regular screening whenever, so that if the retinopathy has started and the vessels have started forming, they can be destroyed in the early phase so that they cannot go into the stage 3, 4, or 5. Um, it can be done with a laser or some other techniques. There are certain, as you know, that the vessels are formed with a factor which is called vascular endothelial growth factor. So there have been studies that some anti-VEGF might be used, but this is that role has been a bit controversial. So it's safe just to say that laser. And in cases where there is detachment or there has been excessive damage, the surgery can be done. And those who have severe, they need regular appointment with the ophthalmologist. They have to be regular on the follow-up for at least 5 years. A very few percentage might get the loss of the vision, and other than that, some might have some squint. The long-term sequelae might be some squint. They might have some refractive errors. They might need glasses or something. But they have to have a regular follow-up with a pediatric ophthalmologist, and that has to be followed. So this is most of what we I want to discuss. If any one of you has any questions, Dr. Tanushi, if you want to ask anything further, I am here to answer.
First screening that is done is at 2 weeks of age, isn't it, ma'am? After after coming out from the NICU at seven
Okay,
days
so
or
that depends on the age of the child. Okay, so if you see the guidelines, it says that the screening when to screen. The guidelines are on page 350 of the neonatal guidelines. So it tells that
yeah.
the child is born less than 30 weeks, then you have to start the screening at 31 plus 6 weeks or 4 completed weeks of postnatal age, whichever is later. Okay, so basically you have to screen them around around 32 weeks. So if the child is 32 weeks or 4 weeks postnatal age, whichever is the later age, you have to screen for them, right? If the child is born above 31 weeks, then you have to screen them at 36 weeks postmenstrual age, right? So there's two different screening ages, but roughly you have to, if you can't explain it in a detail, like, but you say that you will screen them around 32 weeks the uh, of the gestational age, because that is when yeah. If at time the baby has to be discharged earlier, before the screening is due, you can do the screening early, and you can send the child. After that, there are two schemes. Either you need to do the screening weekly or the two weekly. That depends on the condition of the retina. If there is a stage 3 ROP in zone 2 or 3, or if you have, there's some terms like pre or plus disease, which basically is dependent on the how much edema is present, how much congestion is present in the retina, so that depends. So if there are two different criterias, you can have read them in the guidelines as well, that there's a weekly criteria or the two weekly criteria. And then you need to know that when to stop screening, when if there's no ROP, if the zones have been cleared and you can't see anything, then you need to stop screening at certain point. So all of this is mentioned in the guidelines. We have 2 pages in the guidelines, 350 and 351. So you can give a read to that as well. Other than that, I'm going to share a leaflet in the Telegram group. You can read that. Whatever I told is written in a very simple language in that leaflet, and you can read that. And if you have any other questions, you can ask me as well.
the Gauche leaflet, right?
Sorry?
The leaflet by the Gauche, the hospital,
Yeah,
Great
yeah,
Ahmad.
yeah. That's a good one. Yes, I went through that. Yes. Did you go through that?
Yeah, I also went through that.
Yeah, that's really nice. Yeah, it's written really nice, and it's very simple and precise, and maybe you just need to uh keep those uh practice a bit and be a bit more frequent in how you say and how you speak. Yeah, that's it. Other than that,
Ma'am,
I really appreciate your way of talking. You are it's very considerate, and it seems to be making a connection, but we need to practice on the two-directional communication and interaction a bit more, and just not just keep on speaking about your own thing.
but is this a pass, ma'am?
For me, yes, it would be a pass. Yes.
Okay.
Yeah, because you have told most of the things right. But other than that, obviously, yeah, they might cut a 1 point for the lack of the interaction, and one about the clarity of things. How would you say? Because that was a bit juggled up. Yeah, but you did summarize initial part was right, the ending part was good as well. So in between, we'll practice.
Okay, ma'am. Thank you.
Yeah, okay. I hope it was helpful for you, and I hope it was helpful for the other candidates here as well. Does anyone have any question here? Anything other than ROP, anything regarding communication? I can see a lot of.
Ma'am, what I feel like I get overwhelmed when I open the guidelines. I just start thinking what to study, what not to, and it like sometimes just overwhelms me. So, like, if you could just make things simpler, like from the neonatal as well as from the pediatric, uh,
Okay,
mm,
so how would you want that? I mean, simpler in what sense?
simpler in the sense that we could the common ones we all know what needs discussion, and like, but they say this transport is, it's a good thing that you took this out because this was something new.
Okay, maybe.
uh,
Okay, yeah.
similarly, like this, certain things that don't catch our attention but it's important, those kind of things would be great, ma'am, from
So what I
the
would say
common
is
ones
that
we all.
the pediatric guidelines, 2022, 2024, they have to be done absolutely, totally in full sense. You cannot leave anything from there. Okay. Neonatal guidelines are very big and it's really difficult to cover all of them. So that's
Yes.
why I started discussing which one have come in the past. So in the coming few like, 1 or 2 weeks, I'll keep on discussing more from the neonatal guidelines
Yeah, that
so
would be
that
great.
all the important topics get covered. And maybe the session that we are planning to have the next week, we'll discuss the transport one in detail because, yeah, you think, yeah, as you're saying, a lot of other one maybe they didn't have that in mind as well that it would come and it was rather a new thing to come. So we can discuss it next week as well.
Yeah, because the neonatal one is only more, because that is something we can't decide which one to study, which one not to. The
Yeah,
pediatric
they
is
are,
there is
yeah,
everything.
yeah, they get overwhelming. I understand that because there are, but that's why I just decided to keep things stored in a way that we'll just keep on one and one each day, or maybe like one after one alternate day. And maybe you can send your voice message or anything. And if you just, because they are for 2 or maximum 3 pages. So once you do start doing them, like sitting and starting them from one page and doing them continuously, that gets difficult. But if you just open one and read 2 pages and just maybe note the important points and get done with it, you'll at least have a confidence that even if the scenario comes in the exam, you will be have like, okay, fine, I did that, I did read that. So that will give you a confidence. So we'll keep doing that. Yes, I planned that. And thank you for your suggestion. And we'll work on the neonatal guidelines and further we'll discuss the transport one as well and any other that you would like to discuss. If you want to give any further suggestions, you are definitely welcome to give them in the group as well.
Even that neonatal abstinence scenario that I put up in the group, that also can be
Right.
tried as a communication scenario, ma'am.
Yeah, that
That
did came as a communication scenario. Yes, that has come as the communication scenario 2 times previously.
I've read neonatal abstinence syndrome from the guidelines, but like
Yeah,
what to tell that mom, because the mom is more afraid that her baby will be taken away from her, and like
yeah,
because of her problems with addiction. And
yeah,
at the
yeah,
same time, she's on methadone. Methadone is probably a prescription medicine that was prescribed
yeah,
for her because to prevent the withdrawal symptoms in her. But
yeah.
what about the baby and how to like address all those
Yeah,
issues?
that's what all the communication is about. Yeah, because we discussed in the group as well. The communication, the guidelines give you a baseline that this knowledge you should know this. So you shouldn't be wrong in your knowledge. But it's not about just about knowing it's about how you cater the concerns at that very moment of that
So,
very
ma'am, I wanted to
yes.
ask, as the mother is thinking that even this baby will be taken away from her, so
Yeah.
how do we express that part? Like, what is the
Okay,
norm
so
in the
um
UK?
okay, so that depends on the condition. That depends that the social worker team has to be involved in any cases when the parent, the mother has been on certain drugs, the social team has to be involved, and then social worker and the social worker team, the whole team, they basically decide after having a detailed discussion with the mother that is it safe to leave the child with mother alone. Because obviously, if a mother who is conscious enough that she has left the drugs and she has started, she's being on the methadone, it means that she is on the road to the recovery and she is concerned about her child and she wants to be with her child. So that will be the social worker will be involved. They will be there to provide them with any extra care that has to be done. And no one is going to take the baby away unless they find that something is harmful for the baby at the home.
Okay, okay. So that is how we will tell that unless the baby is
Yeah, because the scenarios are really big. I mean, here I just gave you a two-line scenario. Next time, whenever we are going to practice, I'm going to give you the proper scenario because in the exam, the scenario is of at least 10 to 12 lines. It's a big paragraph. So there's a lot of information in that. So probably if that some such kind of question is going to be asked in the scenario, it probably would be given in the scenario that the mother is doing fine now. She's okay. She's been off the drugs. She's been doing fine in the home, and she's really happy to have the baby and everything. And if they want to show some concerns, they'll probably be giving the information regarding that as well. So the scenarios are pretty elaborate and pretty explanatory. So you have to read them properly, and you have to have the points in mind that what has been given you in the scenario, and according to that, you will answer the role play.
Ma'am, another question I wanted to ask. Like when I'm outside the station, I note those name of the parent, name of the child, and little bit about the scenario. Will that paper be taken away from me, or I can
No,
take a
no, you
look
can
at?
take it. No, no, you can take it inside. You can even draw the diagram outside. Whatever diagram you want, you can draw the diagram
Okay, so
outside.
that paper will be
And
with me where I note
yeah,
down
that's
the
good.
thing.
Yeah, but it's not a good thing to look at the paper again and again. You need to, whatever the names are, you need to revise them. You need to repeat them again and again 2 to 3 times so that it is in your it is on your tongue, it is in your mind, so that you don't confuse it. You are going to take the paper inside, but it is not recommended to look at the paper again and again.
Okay, so it doesn't look good if you keep on looking at the paper over and over again,
Yeah,
is
yeah,
it?
yeah. Yes, yes.
Okay, then. Thank you so
Okay,
much.
so yeah, so we are coming to end of our time. It's almost an hour. So thank you so much, everyone. I hope this session was helpful.
Yeah.
Please give a feedback about it in the group as well, and I'm going to share the guidelines there. And we'll be starting a discussion on the new topic from Monday onwards. So thank
Okay,
you,
ma'am.
everyone. Have a very good night and have a good weekend. And see
Thank you.
you all on the group on Monday. Yeah, bye, everyone.